everybody, and welcome back to an invisible and invisible illness awareness project. This week I wanted to talk a little bit about proton pump inhibitors, which are more commonly known as PPIs. There isn't actually an approved treatment for eosinophilic gastrointestinal disorders, but they just use the medications that are currently available, including PPIs. My EOE was first diagnosed when I ended up in the hospital because of an impaction, and the medication I was given in the hospital was a PPI. I didn't realize at first that I didn't tolerate it, and I just kept taking it, but I was having headaches every day, and the dosage of pain pills they were giving me wasn't enough to help. Every day it just kept getting worse, and I kind of felt like, well, I've had a lot of headaches since at least high school, and I take a lot of pain pills, so maybe I'm just not responding because they're not giving me enough and I'm used to a higher dosage. So 3 days later, when I was home again, I started taking double the dose they were giving me, and I was still having these horrible migraines. So I tried tripling the dose, and then it got to the point where I was kind of concerned and trying to figure out what was going on. And finally it dawned on me that it might be this medication. So I looked it up, and I realized that there was some sort of warning if you have a peanut allergy, and I thought that maybe it was just this one brand. Well, next time I had an impaction 2 years later, they asked if I had continued taking my PPI, and I told them I wasn't. So they prescribed me a different one, and I had the same reaction. So I didn't take it as long that time. After the first time, it took another 3 days for the side effects to subside, so I really didn't want to deal with that anymore. And I very quickly realized that I was having the same reaction and just stopped. After that, I realized that I had more serious issues and that I was struggling to just get by and work normally. So I started going to a bunch of different specialists, and they wanted to prescribe me PPIs, and they just kept thinking, well, it's just a matter of finding the right brand, and no matter which one they gave me, I never tolerated it. So in the end, I never really did take them. Luckily, I did get my EOE in remission through an elimination diet, which I'll definitely talk about in another video. But I honestly consider myself fortunate that I never took PPIs long term. In the other videos where I get into talking about different treatments, I talk about more of the mechanism of how that medication works, like how histamine antagonists work on histamine receptors, how mast cell stabilizers work on mastocytes. But honestly, I haven't really informed myself that much on how proton pumps work and are inhibited. But I felt this time like I would get into some of the risks of long-term treatment, because I think that's something that most EOE or AKIT patients are not really properly warned about. I think doctors will just prescribe them, and they're great for short-term use. They're a good alternative to antacids or H2 blockers. But I'm afraid that a lot of people just don't realize that they're not intended to be taken long-term. So here's some information I wanted to share with you guys. PPIs are generally well tolerated. The most common side effects are headache, diarrhea, nausea, and vomiting. However, there can be more serious side effects, such as the following. Gastric acid suppression leads to hypergastremia, which causes rebound hyperacidity, which means that if you're taking PPIs for reflux, then when you stop taking them, your reflux will get worse. That can happen in as little as 8 weeks. Acid suppression can also lead to an increase in gastric pH, which allows certain bacteria to get out of control and then leads to catching pneumonia. You're also at an increased risk of C. difficile for the same reasons. Here's a big one that is targeted more towards elderly, but I think this is very relevant for children because there are a lot of children diagnosed with AKITs, especially EOE, from newborns all the way up. Long-term PPI use puts you at higher risk of fracturing your hip, wrist, or spine. I'm quoting, "A causal relationship has been noted between acid suppression and reduced absorption of mineral calcium in the diet. there might be as much as 41% reduction in calcium absorption after just 14 days. However, it's not yet to the point where a warning is being printed on the label of the packaging. There's an increased risk of vitamin B12 deficiency, which again comes from the increased difficulties in absorbing minerals, which then leads to bacterial overgrowth and a bunch of other problems. There's also hypomagnesemia, hypocalcemia, and hypokalemia, acute interstitial nephritis, which can appear after just a few days, drug-induced lupus, and dementia, which is really not so relevant in the case of AGIDs since they generally affect younger people, but of course if you have it your whole life and eventually get to the point where you're a senior, you want to be careful there too. And of course it can cause issues with other drugs because of how it affects the absorption rate. Like I said, I generally don't warn on the dangers of long-term use of different medications. I know there are risks with any medication you take, and part of the reason I don't like to get into this is because I know there are people that take them and depend on them for their quality of life and would be much more miserable without them. But this is just all the more reason that more research needs to be done to find an appropriate treatment. There is a lot of tension online between people who prefer pharmaceuticals and people who prefer the elimination route. I know some people don't really have a choice. Some people have to do both just to have some semblance of quality of life. But just for the people who maybe haven't considered that there is possibly a better alternative to taking PPIs, I wanted to put this out there. If you haven't tried elimination, it's definitely worth looking into, and I will go into more detail on that next week. If you've taken PPIs long term yourself for EOE, another AGID, or any other reason, let us know in the comments how you responded. If you found some other alternative, let us know what you did and how it worked for you. Don't forget, we now have t-shirts for sale on Teespring. If you'd like to support this channel, you can become a patron on Patreon or donate directly to my GoFundMe. If you haven't already subscribed, go ahead and do that now. And if you like the video, give it a thumbs up, and I will see you guys next week.